Hi, my name is Dr. Eric Janowitz, and I am the founder and clinic director here at Synergy Oviedo Chiropractic. Now, part of our practice specializes on car accident type injuries. We've treated and evaluated thousands of them, and the question that we commonly get is, well, doc, how long is this going to take for me to get well? Well, let me explain that answer to you a little bit detailed here. So when you have a car accident, unfortunately that crash takes typically about a second, but the effects can be very long term, and getting the proper care and evaluation is critical, especially early on. Now, if you've had a car accident in Florida, you want to make sure that you're evaluated by a chiropractor or a medical counterpart within the first 14 days, or you lose your insurance benefits and the ability to get well. But once you get care, we look at care in a phased approach. The first phase of care is called relief care, and that is designed to help you get rid of the immediate symptoms, reduce the pain, reduce the inflammation. That typically takes about a month, but you might see a chiropractor for about 3 times a week for that first month. Then we go into what's called corrective care, which is where we're working on optimizing the movement pattern of the spine, what's called biomechanics. We're working on the soft tissue. We're working on making sure scar tissue isn't lying down. We're rehabilitating the spine. So that corrective phase and that strengthening phase that's afterwards to help secure and lock in those corrections, those phases can take anywhere between 1 to 2 months in each of those phases. So an auto accident case typically takes about 3 to 4 months of intensive work where you might see your chiropractor approximately 3 times a week. Now, every case is different. There's always extenuating circumstances, but there are guidelines out there. One guideline that we have in our industry is called the Croft Guidelines. And I actually studied with Dr. Croft, and the Croft Guidelines for more of a simple type of a whiplash injury can be 11 weeks is the recommendations there, and say 21 visits and to the chiropractor. Now, in more damaging vehicle accidents, or more damaging to your body, I should say, not so much the vehicle, it can be as much as 56 weeks or 70 plus visits as well. So the range is big. The thing you have to realize is that you want to make sure that you're being consistent with your care. Consistency, because each treatment is going to build on the next in retraining your body, preventing the negative pattern that occurred from the injury and helping your injuries heal at a maximum degree. That is the most important thing, to follow those recommendations and make sure you keep up with it. Now, it's really important to do that, so you got to make sure that whoever you see, you can see on that consistent basis, meaning they have to be near your office or near where you live and have hours that can suit you. So in our practice, we start at 6:40 in the morning. That is way early, and we're here till 6 o'clock at night. So we can see you before work and see you after work, and we have 3 doctors on staff to make sure that you're getting comprehensive care in the most efficient manner too, so that this doesn't just overpower your life. We want to be able to get the care you need and get you back to your life and get you back on track. So that's just a little bit of information about how long an auto accident takes to do the care. Again, typically about 3 to 4 months is the intensive work, and there could be some work that is done afterwards. It is called supportive work as well. Now, at the end of your care, you're going to reach a point what's called MMI, and that's something called maximum medical improvement. Now, that's a legal term, a med legal term, and that just says you've got to where you were and the best of where you're going to be. At that point, the doctor might assess if you had any, unfortunately, permanency or permanent injury, and if you had that, they will determine that at that time. But the most important thing you want to be able to do is to get that conservative care at the beginning, and then see if there needs to be other doctors to work with, like orthopedic surgeons, neurosurgeons, neurologists, pain management doctors, all these other teams to be able to get you the most comprehensive care that you need. I'm Dr. Eric Janowitz with Synergy Oviedo Chiropractic, and be safe on the roads.